thanks for being with us today. My name is Debbie Garza. I'm a pharmacist, and I'm currently the CEO of the Texas Pharmacy Association. I'm here with Dr. Leonard Friedland, a pediatrician, a vaccine research scientist at GSK, and he's been involved in the development of more than 14 vaccines currently in use across the United States. He's also a member of the National Vaccine Advisory Committee, and he's passionate about vaccines. I'm excited to have him here with us today. We'll be talking about COVID-19 vaccines and development, and is a vaccine really possible, and what kind of implications that will have for all of us around the world. So Lynn, we're reading more and more about the positive clinical trials for a possible COVID vaccine that could be on the market as early as the end of this year or early next year. A vaccine that has the potential, as we know, to save millions of lives, if not tens of millions of lives across the globe. Yet, there's a significant percentage of people who are skeptical of a COVID vaccine, or vaccines in general for that matter. What would you say to someone who believes that a COVID vaccine or any vaccine's risk far outweighs the reward?
Well, thank you, Debbie. That's a really important topic to speak about. It's pretty incredibly amazing how the entire public health and scientific community have come together to look to create solutions for this pandemic. So important, since so many people are still getting very sick and unfortunately dying from this illness here in the United States and around the world. So we desperately need solutions, both therapeutics and also preventative medicines. There are exciting advances that are happening in the vaccine space with the development of COVID vaccines. There are vaccines in late stage development right now in phase 3, and so many others moving along the development pathway, heading towards generating data to show that these vaccines will be safe and effective. And the best science is being applied here with advances in innovation and technology, and the data is being evaluated by independent safety data monitoring boards, by many branches across the United States government who are constantly looking at the acquisition of all the information, and of course the FDA with their incredibly talented and experienced scientists who will be constantly evaluating the information. And when we get to the point that the Food and Drug Administration can state that the vaccine that they're looking at, or the vaccines plural as they move along, are safe and will offer benefit to our population, well, then that'll be a great thing. And then there'll be many others that come along. And so I have complete faith in this process. No steps are being cut along the way. The way it's moving faster is that things are being done in parallel rather than sequentially. And there's also, in parallel, a major investment around the manufacturing to make sure that we have vaccine that's available for people here in the United States. And so what I say in answer to that question is the best science is being applied. And when we have the right information to conclude that we have a benefit risk where the benefit outweighs the risk and that people will benefit from these vaccines, then they'll become available, begin to be prioritized, and we'll start to get hold of this. It's also important to mention that while we wait for this, we have to continue with the non-pharmacological interventions that are already very effective: hand washing, social distancing, and wearing a mask. We have to continue with that while we wait for these interventions from the pharmacological side to come into play.
So as you said, we're all excited about the speed at which we're going to have a vaccine. And it is real important, as you mentioned, for people to understand it's in parallel, to not any steps being cut, but steps are being done in parallel. So I think, the speed at which this vaccine is in development is unprecedented in the history of the world. And ironically, though, as you know, that has led many to believe the vaccine may not be safe. So I'm going to ask you again to kind of walk us through why you think this vaccine or vaccines would be safe, and why we should get a COVID vaccine once it's available. And I'm going to add in from your local pharmacist.
Absolutely. From your local pharmacist and from any healthcare provider that's available to safely administer the vaccines as they become available in the United States. So in answer to your question, why do I think they're safe? It's because we have a very well-established process for developing vaccines here in the United States. The process is regulated by the Food and Drug Administration, and it's a solid process that has a long-standing history to develop vaccines that become available and are licensed by the Food and Drug Administration that offer benefits to our population here in the United States. A vaccine for COVID is going to be desperately needed, along with therapeutics to treat people who do get sick. We're still having on the order of something like 40,000 new cases reported every day here in the United States, upwards of 1,000 deaths across this country every day due to COVID-19. And it's disproportionately impacting minority populations in the United States, and also people with underlying comorbidities, and the elderly, in particular, people over 65 years of age. And the steps are all here to evaluate these vaccines so that we can have evidence-based decision-making, and that's critical. We need to let the system work by conducting the randomized controlled clinical trials where we can collect the information. Do their vaccines prevent people come down with this disease? Eventually, we'll know how long they will last. We will see about any effects that happen, side effects to the vaccine. So we'll follow patients, of course, after every dose. And then the initial clinical trials will have 1 or not 2 years of long-term follow-up data. The Centers for Disease Control and other branches of the U.S. government are creating many real-time safety programs to evaluate these vaccines once they start to move out of the clinical trials into the larger population. So we have a very solid, well-established way to develop vaccines in the United States. And this is time-tested and value. And all of the pharmacists across the United States know that the vaccines that are in the pharmacy that have recommendations from the Centers for Disease Control are based on evidence and offer benefit to patients. And it's so critical. So if I can just pivot for a second around the COVID for a moment and what's happening. As we move into the fall, we're going to have an uptick in influenza cases across the United States. We're going to have other respiratory diseases that come into play, and the opportunity to come down with other vaccine-preventable diseases like whooping cough or shingles, for that matter. And all of these diseases can bring people to the doctor's office, to the emergency department, or to the pharmacy. And we don't want to overwhelm our healthcare system with sick people as we move into the fall. So we should take advantage now to make sure that that patients speak to their pharmacist, that the pharmacists speak to people who are in the pharmacy setting, and say, while you're here to pick up your diabetes medicine, let's talk about the vaccine preventable diseases for a person of your age. Have you had your pneumonia vaccine? Have you had your shingles vaccine? It's flu season. Have you had your flu vaccine? Did you get your pertussis vaccine? So that we can keep our entire population as healthy as possible. And then when the COVID vaccines become available, they can be administered as well so that we keep ourselves healthy. That's the goal. The beautiful thing about vaccines, and you mentioned I'm passionate about vaccines. The beautiful thing about vaccines is they help us live healthy lives. And so let's take advantage and thankfully, a very common access point to ask for healthcare advice is through the pharmacist. And so you're absolutely on the front line and can offer tremendous advice and guidance to people here across the United States.
No, absolutely. And I'm passionate about the pharmacy profession and the accessibility pharmacists are to everyone, quite frankly. 90% of the population live within 5 miles of a community pharmacy. So huge role that pharmacists can play as healthcare providers, and particularly in many of these medically underserved populations and areas, as you mentioned, from some of the healthcare disparities. In many cases, the pharmacist is the only healthcare provider that's accessible to them. And so that kind of brings me to my next question. What differences do you anticipate with the launch of a COVID vaccine versus other vaccines that are administered by pharmacists or other healthcare providers for that matter?
Yeah, so here there will be some differences because normally we have years of time to prepare. And here we don't have that have the luxury of time right now. So the initial vaccines that will likely achieve some authorization or approval, it appears right now they'll need to be shipped at ultra cold temperatures and stored at ultra cold temperatures before they can go to the regular refrigerator temperature. And then when they even get to 2 to 8 degrees in the regular refrigerator, they're going to need to be used fairly quickly. And so there'll be lots of need for education, and the Centers for Disease Control is certainly going to be providing this to all of pharmacies across the United States on how to store, handle, and distribute these vaccines. That's going to be absolutely critical. They're going to also, the initial ones that appear, they're going to be in multi-dose vials. And so managing that's going to be absolutely critical. The other thing to start with is that in the very beginning, it's likely that the number of doses that will be manufactured and available will not meet the needs for 330 million people here in the United States. The U.S. government is heavily involved right now in working to make sure that we have hundreds of millions of doses of a number of these vaccines available in 2021. But as we get into the end of 2020 and into the early part of 2021, we're not going to have hundreds of millions of doses. We're going to have millions and tens of millions to start with. So there's going to likely be some prioritization. The Centers for Disease Control is looking very carefully at this, as are other groups as well. And the Centers for Disease Control is going to be taking advice from other groups as well, as far as how to prioritize the initial doses. And so the retail pharmacists will need to have knowledge of that, about who's going to be prioritized first. It hasn't been decided yet. There are some guidelines that are coming out, but that'll be another thing that's a little bit different. To start with, there'll be likely some prioritization. That's going to be absolutely critical. And the other thing that's going to be different right now is that, as mentioned earlier, we're still in the setting where we need to have social distancing, wearing our masks, hand washing. And so, having large crowds of people inside a retail pharmacy chain queued up to get their COVID vaccines, well, that's going to have to, be in a way that has the right social distancing and so forth. So I think we may see, novel ways of doing immunization. And also where there'll be, in the beginning, there'll be need for understanding, can you give the COVID vaccines with the other recommended adult vaccines? And so we're going to have to wait and see what the guidance is from the CDC from that.
So, Lynn, simply stated, vaccines are a mechanism that artificially jumpstart our immune system to fight off a particular disease. Once our body knows this, it will continue to fight off that disease. And in fact, it remembers this in case of future exposure. Then, with enough people achieving immunity through vaccines, we achieve what's called herd immunity. Help explain why herd immunity is so important and why people shouldn't rely on natural immunity as a way of keeping their families and loved ones safe.
Yeah, Debbie, that's a really important question. So we hear the word herd immunity. It's also referred to as population immunity. And what we're referring to here is a percentage of our population needs to be protected against a disease, in typically through vaccination, so that people who can't get vaccinated for whatever reason will have less exposure because the people around them are not going to be spreading disease because the people around them are already protected themselves. We don't know what the level of the population in the United States is going to need to be vaccinated or have had COVID-19 disease to achieve this population-based immunity. Some people think it's probably something on the order of 50, 60%, maybe 70% of our population will need to have had vaccination to achieve this population-based immunity. So in the meantime, we should not wait for that to happen, because if we wait and don't protect ourselves with hand washing, masks, social distancing, and then when available, a vaccine, it's possible we'll be exposed to somebody and we could get very, very sick, potentially die, and also spread it to other people. And so it's so important here that ultimately we hope that we have population-based immunity through a very successful vaccination program. But we should not say, well, I don't need to do anything right now because that's going to come. We need to be part of making this happen, which right now is through non-pharmacological measures. And then when vaccine becomes available, our population gets vaccinated so we can achieve that herd immunity. But right now, we have to make sure that our population is going to accept and want to get vaccinated and keep up the non-pharmacological interventions.
And that's been the beauty of pharmacy and pharmacists, their accessibility, but also people visit their pharmacist so many times a year compared to many times the doctor. And in fact, that kind of brings me to my next question. As you know, due to COVID, concerned patients have not been taking their kids to the doctor's office to get their vaccines this summer, but they do come to pharmacies, or the parents come to the pharmacies. How important is it for children to stay up to date on their vaccination schedule? And what do you tell parents who have fallen behind with their children's vaccines?
Oh, so important. I'm glad you brought this up. We don't want to have another public health crisis on top of the one we have right now. We don't want to have outbreaks of measles or whooping cough or polio here in the United States. The vaccination program in the United States for children and adults is highly effective, and families don't know about the devastation that measles can bring, or chickenpox can bring, or pertussis can bring, or Haemophilus influenza type B, which was something that I dealt with when I was a resident back in the late 80s. Families don't know about this, and because vaccines are incredibly effective. And we've seen dramatic declines in immunization rates across people of all ages as people were sheltering in place and not going to the doctor's office, not going to the pharmacy. But as you've said, that's changing. People are going back for their well visits. They're going to the pediatrician. They're going to the pharmacy. Pharmacies and pediatricians have created, as you said earlier, very safe ways to make it safe for people to be in that environment, with different hours where sick people and healthy people are, traffic control through the pharmacy, hours, etc. And so we're starting to see good recovery in pediatric vaccination in the doctor's offices, and then whatever vaccines can be given in the pharmacy as well. And I'm sure we'll talk about the recent HHS announcement, which I think is very, very, very important and a great opportunity to make sure that we're not missing vaccination opportunities. But we're not seeing this change in adult vaccination. Adults also didn't go to the doctor's office when they were sheltering in place, and they didn't go to the pharmacy to get their vaccines. We've seen dramatic declines in adult vaccination across the United States. One study that I'm aware of showed that in the Veteran Affairs hospital system, there was an 88% decline in pneumococcal vaccination for adults. I've seen data that suggests more than a 65% decline in shingles vaccination in adults during this pandemic. And so we don't want people to show up in the emergency departments in the fall with pneumococcal pneumonia, or presenting to an emergency department with a case of shingles when they could be around other sick people. And so it's really important that we take advantage of the pharmacy environment to get people up to date on their adult vaccines. Going to be so important. And then, of course, I'm sure we'll get to this too, but influenza, incredibly important vaccine for adults and people of all ages. Everybody above 6 months of age is recommended to get an annual flu vaccine by the Centers for Disease Control. And the pharmacy environment is a critical, plays a critical role in making sure that our population is vaccinated for influenza. And I'm sure we'll talk about that. So in answer to your question, vaccination is so important for people of all ages. And the pharmacy environment plays a critical role in keeping our population healthy.
Now, that's so important. And I know from a pharmacist's perspective, we were really thrilled to see the recent announcement mid-August from the United States Secretary of Health and Human Services speak to the fact that pharmacists may now order and administer all vaccines for children ages 3 through 18, which had not been the case in every state, Texas being one of those states. So we were excited under the order of the PrEP Act federally, in light of the disaster pandemic we're currently in as a country. We have that allowance. And of course, there's certain requirements we have to follow. And part of that is communicating back to the pediatrician if they have one, making them aware that the vaccines have been given, as well as reporting it through the immunization information system at the state. as well as encouraging they see their pediatrician for that well-child visit. So I know we'll speak more about pharmacists' role later on, but I thought it was important that now there's more access points, and not just the state of Texas, but other states that possibly did not allow that before in light of this new announcement.
Yeah, I know. It's the more access points, we don't want to miss the opportunities. So I'm glad you brought that up. I think it's very, very important.
Right. Well, Lynn, thank you for your insights. There's so much good information for us to take in. I think clearly you've pointed out that the COVID vaccine will be safe. There are not steps being skipped. There are steps being run in parallel and utilizing new technologies and such, but also the importance of still the independent safety boards will be monitoring this, talking about how important it is that both children and adults are up to date on their vaccines to not have problems and burdening the healthcare system later on when we do have COVID and flu commingling at the same time. So thank you so much for this information. It's been really helpful. Thanks for joining us. We appreciate you. Please be sure to hit the like or subscribe button to get notifications for future episodes like this. Thank you and have a great day.